With us now, Medical Director of the Primary Care and Chief of Staff, Dr. Andy Dunn. Thanks for coming on this morning, Doctor.
Hey, thank you for having me. I appreciate it.
So the Wyoming Medical Center's Respiratory Screening Clinic. Now, my understanding that is not a COVID-19 testing clinic. So what then do we do there?
Well, great question. And the thought was that we were going to consolidate all the chief complaints of respiratory symptoms, respiratory illness symptoms in one place. That way, you have allocation of resources, PPE, available to work on a specific differential diagnosis of patients coming in. So it's not just COVID, but it's also influenza. It's also strep or rhinovirus or adenovirus or any of the viral stuff. There are 4 different coronaviruses that cause cold-like symptoms, but it's a place where people can come. We can discern what we think is going on. We can collect samples for COVID if they meet certain criteria. So not just a COVID clinic, but a respiratory clinic where people can be educated on the symptoms, on that, hey, this isn't COVID, or maybe it is. So a place where we could, again, consolidate manpower and resources and create an educational tool for the public.
And doctor, how many patients have you screened so far? And I also want to ask, who should go to the clinic? I mean, there is some risk, is there not, of going to a place if you don't have the virus where there's a whole bunch of people who think they have symptoms. So at what point should an individual say, yeah, I need to walk myself down there and get looked at?
Yeah, you're right on the money. First of all, we take all the precautions of not having more than 3 people in the waiting room, 10 feet apart. They're wearing masks. Everyone's wearing masks. Hand sanitizer, hand washing. We have a drive-through capability. We also are seeing patients in the car in the parking lot, so in isolated rooms. So we're really keeping social distancing in a very sterile environment. And again, having patients wait in their cars, we'll see them in their cars and have to go through the drive-through. But that's a great point. So we don't want to create a center or a clinic where people are coughing on each other. That'd be counterproductive. But it's a great place to seek out potential evaluation for COVID testing collection. Some people need to be quarantined. There's a whole algorithm, but we also have a telehealth hotline as well for the respiratory symptom screening clinic, where people can come in, talk to a registered nurse, who will then either send that appointment to a provider on the computer, or to be referred to the respiratory symptom screening clinic, or maybe you need to go to the emergency room, or just stay at home. You're doing okay. Here's some answers to your questions. So a very versatile clinic, and again, with the goal of educating and not making a situation worse.
Let's talk about where you're located at and what kind of a range you have for people who might be able to call and see if they need to come see you.
Yeah, you betcha. So we're located pretty close to Wyoming Medical Center, 245 South Fenway, where the old endocrine building used to be, or clinic used to be. And we're open 8 to 8, 7 days a week. And then our hotlines on the telehealth hotlines on our website as well, and the Wyoming Medical Center website. And we're focusing on Natrona County. We need to make sure that we have the infrastructure to take care of the people in Natrona County first, which we're doing. This is it's going quite well, actually. In terms of collecting numbers, we've seen some days you'll see 30 patients, some days it'll be 150 patients. But going with the algorithm that the Department of Health, the State Department of Health has laid out in conjunction with Dr. Dow, Dr. Ganem, and Wyoming Medical Center, we're not testing everyone that fits respiratory symptoms. There's an algorithm of over the age of 65, or comorbidities, or immunosuppression, or potential exposure to high-risk populations such as healthcare worker or institutional worker, or I live in a dormitory, or so there's a lot of thought that goes into the who should receive the test. But it's usually we're about 10 to 20% of the patients that come in are meet that algorithm, and that we eventually do collect the samples for and send down to Cheyenne.
Well, we are working on and focusing so much on coronavirus, but with a clinic like yours, I want to make sure that people understand if they have some other problem, they can also stop by as well. But how do they make sure that they're not walking into a situation where, once again, like Nick was asking, there might be someone there who's sick and they don't want to be around them?
No, that's great. And again, I love these questions because that's what we're here for, to answer these type of questions and to promote good health and the betterment of quality care to the community. And so we have a phone number that's listed not only on the website but on the door that they can call from their car and simply ask that question. And then we could talk to them about, well, yeah, maybe you need to be seen here, or XYZ, or emergency room, or immediate care, or something if it's not a respiratory thing, but maybe an earache. Yeah, so we can't do this with scripting. We do this with this kind of questions and answer with people directly. That's the only way we can do this together. I always tell patients, I see a lot of patients in primary care saying that I love when people, you can look stuff up on Wikipedia and let's talk about it, because that's what my job is. My job is to have that conversation, to answer those questions. So that's the role of primary care, actually, is to have those thought-provoking conversations. And so if you have questions, call us up. You do not have to walk in anywhere. You can call us from home. But we're also taking the precautions in the clinic to make sure that, to the best of our ability, that everyone is staying appropriately away from each other, and mask. And for every patient that comes to the door gets a mask and hand sanitizer. It's the first thing they do. So,
certainly. And I wanted to ask you, Doctor, a part of this clinic is centralizing, as you said, resources, kind of a one-stop shop for these symptoms, and obviously you have a variety of ways to handle it. That said, I think one of the advantages, of course, is keeping people out of the ER, out of doctors' offices with these symptoms, trying to prevent them from going too far afield and spreading the virus in some of those places where you're talking about important healthcare facilities. But there is one symptom, and you can go over the several that exist with this virus, but shortness of breath. When people have that, they should call 911, right?
That is correct. So respiratory distress, if they're really short of breath, or it hurts to breathe, or they're gasping for air hunger, absolutely. We're a clinic and we're not the emergency room. Our goal, like you said, is to offload volume so that the ER they're still seeing their strokes, they're still seeing heart attacks, or their COPD exacerbations, traumas. So we need to. So we are offloading, but respiratory distress is respiratory distress, and that usually requires an acute emergency evaluation. You're correct.
Okay, Dr. Dunn, before we let you go, I just want to make sure with all the patients, you said up to 150 during the course of a day, could be that high. You got the resources you need?
Well, and actually, I'm sorry. The most we've seen is 150.
Okay.
And we do. The hospital has been great in supplying all our PPE. We have a lot of great providers. We have doctors from different specialties. We have a neurosurgeon that's spending time with us, and again, primary care folks and surgeon spending time with us, and great physician assistants and nurse practitioners. A really good team that's all on the same page, talking about the same algorithms and the same standard of care. So feel pretty fortunate, pretty blessed right now. It's a great tool to fight this.
All right, Dr. Dunn, thank you for your time. I appreciate you coming on.
Thanks for what you're doing, Doctor.